It gives me immense pleasure to introduce Dr. Nehal Shah. Dr. Nehal Shah is the founder of Rituja.org. She is also an expert in PMS with an experience of over 20 years in research, academics, youth, social services, and conservation. Dr. Shah, a PhD and an MPhil in PMS, with over 20 years of experience in the field of academics and research, has worked with over 800 young women and teenage in the age between the age group of 15 to 36 years. She has worked around the physical, psychological, behavioral symptoms of PMS in these women and has found out 95 different adjective parameters that affect the behaviors of the women in this stage. During her journey, she saw that there are disparities on ground and decided to bring about a transformation in the society by conducting serious seminars, workshops in schools, colleges, and other educational institutes. Rituja.org, founded by Dr. Shah, is an NGO which is registered under the Public Charitable Trust Act of India, and this strives to make a difference in the society by endeavoring and program towards women's empowerment, health, spirituality, gender awareness, equality, and other eco-friendly and sustainable means towards the future. Dr. Shah has had a lot of experiences during the COVID area to reach out to people to whom help was not available. She not only reached out to them, she provided enough processes to strengthen their mental and physical health. Team Rituja continues to conduct diverse activities from month to month across different sectors and actively helps to communicate over the social media handles. What Dr. Jha will what Dr. Shah plans to do today as the first episode of AL50 period talks is he's going to explain how of what a woman goes through during her first menstrual periods during the puberty and how does she get into the puberty during her adolescent stage. Over to Dr. Shah.
Thank you so much, Ruby ma'am, for the kind introduction. I'm sorry, everybody, there is some network issue, and that's the reason my camera is not working, even though it's switched on. So please bear with that. I'm talking all the way from my college institute, and maybe there is some network issue. But I'm sure that you will be enjoying the talk over here. And I'm just sharing my slides so that we can start directly onto the topics to be discussed today. So meanwhile, my slides getting rolled on to the screen. I'm very much thankful to all the participants here. I see there are a lot of NGOs and foundations who have also been a part of it, and I can see some young girls from Poonam Sanial's window. So I welcome all of you to the first episode of today's program, and we want to discuss what exactly puberty means all about. So
Hello. Sorry
yes,
to
please.
interrupt. Yes, but the problem here we are facing is like the youths here, they have been connected from my laptop, but there is a speaker problem for which like here we have the like slide for in the projector, yet like we have speaker problem for which they cannot hear. So
Poonam, what we will do is you try and see if you can fix your speaker problem. Meanwhile, we will have this session shared with you somehow, or whatever has been discussed. We will make a note of it.
Like both.
Unfortunately, we are not able to record this session live, but whatever has been discussed here, we will ensure that there is a sharing of the knowledge with you. Does that work,
Okay.
Poonam?
Okay. Okay. Okay.
Meanwhile, you try and fix up your speakers. If that works, nothing like it. Okay.
Yes. Okay.
Thank you so much.
Okay, so
Sorry, Dr. Shah, you may continue.
yeah, that's perfectly okay. My screen is getting hanged down. Can you see the screen now?
No, not yet. Not yet. Yeah, it is coming on right now. Yes.
Yeah. Okay, so this is what we want to discuss today. My focus today on our topic would be to bring out the difference between the words adolescence, puberty, teenagers, because these three words are very close and we eventually use them interchangeably. So we'll discuss these three words first. Then we'll discuss how puberty sets in the females, what are the physical and mental changes happening to a female during the puberty. There was a question related to
Dr.
nutrition,
Shah,
so
just
I'll
sorry
also
to
add
interrupt. Dr. Shah, can we put it on a slideshow mode? There is a
okay, just a
paintbrush at the
minute.
bottom of the screen. If you can just put that on.
Can you see it now?
Not yet.
I have made it full screen.
You could do it on a presentation mode, maybe that will help. You know,
That is what I did. That is what I did. I did it on a
uh,
presentation mode.
right
I'll
now,
increase the slide part.
okay, fine, fair enough. Let's continue. Let's see. Okay, thanks. No,
Okay,
you
so
have to. No, you have to do this. There's a paintbrush at the bottom of the screen, right hand side corner on the orange panel. Can you see the paintbrush icon? So, just you have to click on that icon to get this going.
I have already done full screen.
No, I'm not. You
It's
don't need
full
to. You
screen.
don't need to do a full screen. You need to put it on a presentation mode. Full screen is taking some part of it away from the screen.
Or ma'am, you can watch.
What you could do is on the top you can see the slideshow, right? There's a thing called slideshow on top. There's a tab called slideshow. After home, insert, design. No, not that. In the second one, home, insert, design, transformation, animation, slideshow. Yeah, in that. From the beginning, do the first icon on the left. Just click on that. Yes, ma'am.
Now can you see?
I think it will slowly get there.
Now it's fine.
It's doing it, I think. Not yet. Hasn't taken it yet. Okay, fine. Let's start off. Let's see how it goes. Thank you, ma'am.
Okay, so the first slide. What does the term adolescence means? So this is a term which comes from Latin word and it means to mature, something which has to grow in terms of adulthood. And adolescence is the most critical term and most critical phase because it's the transitional stage wherein the girls pass through lot of physical and psychological development during their period, and they are changing themselves from a child towards becoming an adult. And that is what is the transitory period, the age which is labeled as adolescence. There is some question from Ruby madam. Is it okay? Should I continue? There is something in the chat box. I can't hear you.
Please ignore the chat box for now. We will attend it at the end of your question, at the end of your session.
Okay.
We'll help you
Okay,
sort that
so,
out. Not to worry. Thanks.
Okay, so we have this, no, as in transitional stage, and this is where there are different countries which are going to pick this up in a different way culturally. So the expression of being an adolescent may be a little bit different from country to country, state to state, but it is definitely perceived by people, in a way that there are some changes happening to the female's body physically, psychologically, and also emotionally. So that is what is the simple term adolescence means. If this is adolescence, then what about the other word that is what we are looking for, and that is related to teenage. So teenagers and teen word is something which has to do with the numbers that we speak along when the children are stepping up into different age groups, 12, 13, 14, 15, likewise. So it is something related to the number that is teen. Okay, age number teen, and that is why many people, they no use it interchangeably with adolescence and label it as teen. Usually this age is going to be between 13 to 19 years, and obviously this is the same age group which is related to adolescence, so that's how it coincides and it is interchangeably utilized. Although science and body development tells that no, it's not necessary that every child is going to have same pattern and same pace of development. So there will be children who have their brain development and cognition which is still continuing to develop even in their early 20s and mid 20s. So even at the age of 21, maybe there is their brain capacity which is still improvising. So that can also happen. But these are the terms which we normally are going to use. One is teens and teenagers, and one is adolescents. And that is the reason, because the development of the body may be a little bit here and there, depending on the geographical region, the culture, the genetical background of the child, the kind of sex that is coming for that human development. You cannot precisely label the age. Usually it's going to be 10 to 19 years, or somewhere between 10 to 24 years. That is going to be the adolescent age group. But I cannot precisely say that the girl is surely going to be by 10 into her adolescence or by 15 into her adolescence. So its age is just a rough marker to find out whether the child has started going towards adulthood, whether they are going through the transitory phase of their life or not. So it's a number which one has to observe with lot of other physical, emotional, and psychological characters. Then comes another term, that is puberty. So this is what exactly we are going to talk today about, and this is also an interchangeable word which is relevant to adolescents as well as teenagers. And why puberty is to be talked? Because after prenatal and neonatal growth period, this is the fastest, the most rapid physical growth period of a child, be it male, be it female. Here, the human development process takes place faster compared to the remaining phases of the life. And that is being done by the body through hormonal changes. So both girls and boys undergo typical hormonal changes, which leads to this immediate and rapid growth, physical development, and spurt in their growth. And that is what is the key feature of puberty. And this would be again the same age group, 10 to 14 around in case of females, and similar in case of the males. How do we mark puberty? So one thing is by the age group. When we are going through the age group of the females, that's one marking of measurement. Another thing is when the females, they start coming across their first menstruation. So hormonal changes leads girls to experience their first menstruation, which is technically termed as menarche. So menarche is going to be the one of the marker to understand that the girl has stepped into her puberty. If boys are there, then it's going to be their first ejaculation, which is known as seminarche. So I would be taking somewhere the comparison because that helps us identify the growth and the factors between the male and female. So that is the reason somewhere, no, few times I might have even taken up something related to males. So this is how we can demarcate that girls have stepped into their puberty. Puberty is again going to be important in terms of many other factors. For example, let me move on to the next slide. So when I'm talking about the hormones, how it is going to work here. So hormones, they are basically chemicals which are secreted by the body. There are special glands present inside the body, and they are going to be functional. No, as per the genetic programming, they are going to start releasing these chemicals time to time. Nowadays, what happens is that number of times we also see people coming into early puberty. The reason being is that these chemicals are no being secreted by the glands out of the influence of our sense organs. So there was a question by somebody during the registration form that why people set in the early puberty. One of the reason is that today's youngsters, they are highly exposed to a lot of media, lot of movies and internet and lot of picture stuff. So those kind of visual effects do remain onto their brain for a long period of time, even though they do not have a mental understanding. But because they have a visual knowledge, that visualization is going to excite the pituitary gland, which is the master gland of the body, and that master gland is going to start secreting and going to start making release of important hormones which are required for their adulthood. So here there are two important glands which are very much linked up with pituitary. One is ovaries in case of female, and another one is testes in case of male members. So these ovaries are going to be influenced by pituitary and hypothalamus present in the brain of the child, which is releasing gonadotropin releasing hormones. Now this gonadotropin releasing hormones are the ones to trigger the ovaries to start undertaking release of certain particular hormones. Along with this GnRH, which is what is gonadotropin releasing hormone, now two more hormones coming from pituitary gland, luteinizing hormone and follicular stimulating hormone. These three, their interplay is the one which is going to activate the ovaries, and then the menarche is going to strike. So when a girl comes across her first period, it is because of this chemical interplay which is happening between hypothalamus, pituitary and ovaries, which is ultimately making her set into her periods, and that is how the menstrual cycle sets in. So this is why puberty strikes. This is one of the reason, and this is what is going to also allow the ovaries to start secreting her estradiol hormones. So ovaries are the ones which will be producing estrogen. Estradiol is the no bigger analog of estrogen. We usually have a lot of derivatives, but we would make it consider as estradiol for time being. So estrogen is popularly the known derivative analog of this estradiol. So that is that starts secreting, and that amount is increasing. So in both the cases, male and female, there will be this kind of hormonal secretions happening, but because female body has to be made the girl's body has to be converted into a female, the secretion of estradiol will be more compared to the male steroidal hormones. So that is how the hormonal interplay starts, and that's how the girls start experiencing their first periods. And along with that first periods, there are a lot of changes which are also being experienced by them on a personal ground. So this would be a relatively a personal experience for each girl, how they go through emotionally, how they go through the experience of looking at their body converting from a child into adulthood. And that is where all those NGOs who are linked up today into this meet, I would request them to help the kids understand their body by this particular way, because that is what is the most essential aspect which we miss out. And this leads to the quarrels and the misunderstandings between parents and teenagers. So then when we say that there is going to be lot of no generation gap, the reason is because of this, that parents are not able to understand what the child is going through during this transitory phase, and children are already facing lot of identity crisis as their bodies are responding in a different way. So what all they go through when these changes are happening, the first thing is that they start understanding the difference between boys and girls. So there is a very important demarcation they themselves start deriving, and that is how boys are different than them and how their peer group is similar to them. So they start going more closer to their same sex peer, and they also want to bond with them more because they see that their girlfriends are also going through the similar kind of process, and whom to share all these things. So if they do not have a good healthy relationship between themselves and their parents, it's very detrimental for the girls because they do not have the right correct scientific information that they obtain, and maybe they really no go on to the wrong things. So that is where the healthy relationships matter. That is where the role of the teachers in the secondary and higher secondary schools also matters a lot, because they would also come across girls of this particular age group. So the young adolescent girls, apart from identifying themselves as different from boys and getting closer to the girls of their similar age group, would also be growing in terms of their intellectual capacity. So their cognition powers are increasing, their mental faculties are developing, they are also experiencing more moral development in terms of their thought process. They are undergoing lot of social identity check by their psychological means. So now is the time when they start judging, they start finding out things for their own self image. They are trying to figure it out who they are. So they are looking for questions related to things like that, how I am looking, or what is my image, how people look at me, how people take me as a person, what kind of personality I hold, and what is my importance. So a lot of parents, they complain that the children, they feel that they are not being given appreciation, or they are not being important to their families. The only reason is this, that they have this self image crisis, and that is why they feel that they are not important to the families, and there are going to be lot of quarrels and misunderstandings between the parental group and the siblings. Particularly if the parents are giving more importance to the elder child and less importance to know them, then there is going to be a comparison that why not me and why the others. So this kind of things do happen with them, and this is a critical time period that when they feel the lows, maybe they would move towards going for some substance abuse, or maybe they become a part of some bullying which has a long term traumatic impact onto their mental health, and they may be risked to sexual abuse, or they may be risked to some violence or sexual behavior as well. So there was a question in the registration that what NGOs can do. So NGOs can help them become more aware about themselves and their mental and emotional status during this particular time, so that they don't become victim of this kind of a problem, which is a substance abuse, or which is a sexual abuse, or some sort of a violence that might turn up. So that is a typical kind of change that every girl undergoes, and they are very much observant about their bodies, which is again a very very natural aspect to them, because it's a mix and match. They are not able to understand what's happening to them unless you educate and make them aware about. So the puberty of the girls can be divided into four different stages. So if I go by the science, the first stage, when this chemical play, hormones are interplaying, it's going to be with reference to the stimulation of the hormones, and that would be known as adrenarche. So adrenarche is when the girls are experiencing a stimulation of hormones across the body, and there is going to be development in terms of height, in terms of their physical body development, and this would also trigger body smell. There will be sebum production, so girls will start developing acne and things like that onto their no face. There will be some facial hair grow also, that is also going to be visible, which they might not have come across in the no in this particular childhood. That might be visible over here, and lot of physical changes will be seen. So that is what is adrenarche. Along with adrenarche, in few years and months time, they are going to step into a pubiarche. That means the pubic hair starts popping up. So there will be a pubic hair onto the no the groin region, the lower abdomen part, along with the no the underarm pubic hairs that will also start developing, and with that there is going to be the beginning of appearance of the breast buds, which is what is known as thelarche. So simultaneously this kind of changes are happening to her body, and because the chemicals, the estrogen, the follicular stimulating hormone, luteinizing hormone, pituitary is highly active. So what is happening is that there are sudden lot of chemical changes in the body which are difficult to understand and very difficult to handle, and that is the reason that their mental aspect is very confused. So many a times teachers have a complaint that students are not concentrating, they are getting diverted, they are not paying attention into their studies, their behavior has changed. The reason is that things are changing within their body, and that has to be actually educated to the child so that they take it healthily, because there is also somewhere the link of shame with this kind of thing, that what's happening to me. And unfortunately, if there is not a good communication between teachers and student, or between the child and the parents, then nobody is going to guide that particular child. The confusion part will continue for a long period of time, and that could be really no bad in terms of their development, because this is a healthy process. If the things are changing, if the girl is setting into periods, it's really good, that means the body is healthy. But she needs to be taught that setting into periods, it's normal and it's very very healthy, that your body is responding to changes. Now that is unfortunately not being revealed at the right moment and right time. So this is what is happening during the changes. Just a minute. So we have this slide which is showing in which years what kind of changes are going to happen, right? So you can see easily that from the age group of 10 somewhere, the budding process of the breast starts, and similar time period, there is going to be growth of pubic hair. Now this is a kind of approximation. It's not necessary all these changes will happen to the person at the same time. With different people, different kind of things can happen, but these are the secondary sexual characters which usually are being seen during the puberty of the girl child. And the lower slide is of the boys, that's just for our comparison, but you can see that it's all between the age of 8 till that of 17 maximum. So during that time, this kind of growth of underarm hair, change in the voice, growth of the abdominal part. So girls are going to have more enlarged abdominal portion compared to the boy. There are going to be growth spurts in terms of height, in terms of weight gain. Many a times, many girls, they do gain weight, which is absolutely normal, but because they become extremely conscious, they get worried that why suddenly my weight is increasing. So that is all because of the hormonal changes that the girls are passing through. So there are different time periods when this kind of characters will be visible into the girl child, and this can be first or second depending on the child. So it's relative to the person. It is a personal no growth pattern with everybody. So it's not necessary somebody is going to show budding of the breast at the age starting from 8. Maybe the budding of the breast comes very later in that case, and maybe the no menarche comes somewhere at the age of 10. That is very likely to happen. So that this kind of interchange is possible because it's all what is decided by the chemicals and how they are expressing themselves through the body. But this is what is changing with their body, and that is how the tenor stages, no 5 tenor stages can be understood for the puberty of the girls. So this is you can see that when they are in the age of 10 to 13, it will be labeled as early adolescence or many a times pre-adolescent stage. So here the growth pattern of pubic hair is going to be different. So I'll be sharing one more file wherein I'll be showing you the difference of how the pubic hair development takes place in the lower abdomen part, and how the breast development takes place, because these are the most important expressions that are being seen during puberty. And if there is abnormality, the doctors are going to check these kind of aspects to understand whether the girl child is passing through appropriate puberty stage or not. So in the early 10 to 13 years, there's going to be very less pubic hair development. The hair structure is straight, it's not dark and curly, and the hairs are going to become more darker and curly by the time they are into their middle adolescent, that is somewhere 14 years. So by this time they should be into their menarche also, and there is going to be more abundance and growth of this particular pubic hair, and even the texture becomes more coarse. So that is what is happening in case of the pubic hair. By the time they have crossed 18, they have the complete middle part of the thighs covered up with pubic hair, which are extremely curly. So this is how the pubic hair grows, starting from the puberty till that of the 18 years. Now there can be some difference in the amount of the growth of the hair, again depending on the chemicals released and how the growth pattern takes place in the child. Same goes with the breast development. So initially there is going to be the buds of the breast which are developing. Later on, the areolar region is going to increase, and the contour of the breast is also going to increase. So by the time she becomes an adult, the nipples are going to project out, and the areolar part of the breast is going to be completely developed. So here I would like to share another slide. So I'll just stop projecting this presentation, and I want you to see one more aspect to it. So these are the tenor stages. So we'll not go in the reading part, but I wanted you to go through the this picture, basically the picture part. So let me just focus on that. I'll enlarge that portion. So this is what exactly the stages are going to take place. So in this first stage, if you see carefully, you will be able to figure it out that this is the male portion, the male development. So we'll not look into this. But in case of the females, when they are passing through their early stages, there will be very little, no hair. Later on, there is going to be development of some sparse hair. Little of them will come up onto the labia portion, and they are going to be straight. But then in the third tenor stage, it's going to be darker, more curlier, and more coarse. So that's how the development proceeds. By the time she becomes adult, her complete the labial portion and the genital aspect is going to get covered up in the middle of the thighs with lot of quantity of pubic hair, and with more curly and more coarse things. And this is what needs to be checked, and this is usually being checked by the doctors if there is some problem with the adolescents and they are not completely developing, or they are not passing because of some reason through their normal puberty. So this is what happens with the pubic hair. How about the changes with respect to breast? So these are the changes that is happening with the breast. So this is where no, there is no much change. It's going to be a very flat portion in the pre-adolescent time. But when they set into their menarche and the chemical play starts, so you are going to have the areolar region and the papillae from where the nipple has to develop. That starts budding, and slowly that portion is going to enlarge. So you can see here there's a change in the breast contour that is more enlarged when the tenor stage increases and we reach to third, fourth stage, and by maturity the mature female breast is developed completely. So this is how they pass through a change, and this is what is visible to them also. Unfortunately, this is not being explained to them that this is normal. So there are many girls who might go through emotional shock. Maybe they don't understand what's happening, and there's going to be a lot of confusion related to it. So now I'll reshare my slides so that we can discuss more onto the remaining aspects of today's lecture. So these are all the tenor stages that girls are going to pass through, and ultimately the nipples are going to project up. So it would be something like this. Okay, so you can see here the no breast development is there, and from this side you can see that in the middle between the two thighs there's a complete development of the pubic hair. Now comes with the abnormalities. How do we understand that the child is going through abnormal problems? So somebody also inquired about this in the registration form, so I have just taken up little aspects. So one thing is there can be delayed puberty with number of children, that is possible. And in case of periods, the periods may get delayed with maybe somewhere till 20-21 years of age. And if the girl is not setting up into periods by 15 or 16 years of age, it's good to contact a gynecologist and get her no development checked, so that we understand what is wrong and why the cycle has not been set. But in many of the cases it's also normal. So it's not necessary if somebody is not coming across period till the age of 18 means there is some abnormal puberty disorder. It can be absolutely normal, but there is definitely a need to go to the doctor and let the doctor decide whether the child is normal and yet the period has to come late, or there is some kind of puberty delay. So that has to be checked up. And it can be it can come up easily even at 21 years of age. In fact, in olden times people not necessarily were stepping up at 13 or 15. Now it's happening that girls are more exposed to media and all, and they are setting into their periods little bit more early compared to the previous generations. But there were generations when they were going into their first year of college or second year of college, that time they used to strike into their menarche. So that was absolutely normal even during that time. So that has to be checked by the doctor to understand whether they are suffering from delayed puberty, or actually there is a normal thing, but the body has not come up into that particular phase. So that can be delayed or may not be delayed. It needs to be checked with the doctor. If the puberty begins too early, before the age of 7 or 8 in girls, then many a times what happens is it would be labeled as precocious puberty, but in that case they might not come across a menarche or menstrual cycle, but then they have unusual development of the body, like the breast development is too fast, maybe no, their body weight is too fast. So that time one has to check with the doctor what can be done about this. So that would be known as precocious puberty. Contrasexual pubertal development can happen, in which case the male characters will be developed into a female, and that can be a displacement of the chemical hormones. So they might be suffering from some hormonal disorders, because of which they have started showing up the male characteristics. This also happens in male members. So that can be no checked with doctors again. In case of delayed puberty and precocious puberty, there are not much issues with their fertility or later life development. But in contrasexual pubertal development, there can be issues if the hormonal imbalance is not temporary. If it's some syndromic aspect, then it cannot be recorrected. But if it is a temporary phase, there are a lot of hormonal medications available now, so that can be provided, and the child can be really no helped out. That is possible, but that only endocrinologist can decide what is the actual role of the hormones playing over there. And then comes the premature thelar, breast development without any other signs of puberty. This is also quite common. This also many a times happens, but this is what I understand from my experiences. It's more because of the exposure to the media, and because there is a lot of visual triggers that are being given by the females, because they see a lot of things, and there is a lot of exposure onto their senses. So this happens many a times, and again there can be a hormonal play. So in males also this happens. Breast development happens because of too much purge of the hormones. That is one of the reason which happens. So there are few of this pubertal disorders which are there, and they can be treated. It's not that there is no treatment available for it. The pediatricians understand this kind of a problem, and it can be very well taken care of if we have alarming situation and you have recognized it in the earlier time. Then comes the nutritional needs during adolescence. So here I would suggest the person who has inquired about this, there is no specific as such nutritional need for the adolescent. We everybody needs balanced diet. So here this person also needs balanced diet. But what we have to understand is what kind of this children are going through. Suppose they are the ones who are into lot of study activities. They are sedentary children who do lot of only studies and not much play, or no sports, no much physical activity. Then in that case proteins are required, because for their brain functioning that would be very important part, and the usual normal development would require all the balanced food that is needed as they are passing through the growing stages. So everything is needed. Fats are needed, vitamins, minerals, everything is needed. But then again it has to be on the personal ground to be checked, because Indian females, 80-90% females have lack of hemoglobin. So obviously if that is the case, you need to provide iron more, you need to ask them to eat vegetables more, need to ask them have fruits more. So that would be on individual basis. On an large scale, on an average, everybody needs balanced diet. So they should be given proper balanced diet. And depending on if the female child is into sports activities more, maybe she will be in need of more food which helps her stay physically strong. But if she is a normal healthy girl child going through the normal aspects of her life, then on an average 2200 calories per day is her basic requirement. And if her growth is in a smooth way, nothing more additional has to be given. So nothing more is basically needed, just a good balanced diet which has good stuff of protein and minerals and vitamins. So that is how the nutritional aspects would be. And I really want the NGOs to come forward to help sort out the issues related to the teenage. So I am addressing this for those who had inquired what would be the role of the NGOs. Your role is do as many educative and awareness activities related to the body and the emotional and the mental aspects of the changing aspects of these girls during this particular period, because that is missing. What I have understood that during even if these are there into their textbooks, these are being skipped up. They are not being taught about their body development. and that is what they actually need to understand in a scientific way. Now, when you don't get the knowledge coming in the true way, what happens is they are curious enough to know, so they are definitely going to look for this kind of thing somewhere or the other, and that is where they'll go to the literature which is not ideally suited and which is not scientific. So a lot of educational awareness activities are needed. Parental counseling is must, because then they understand their children in a better way, and if they understand the behavior of the teens, they can help them. If there are parents who are joining this particular session, I would really like to tell them that you need to become friends to your daughter. This would be the time when they need a friend and not a mother. So they are more looking for a friend with whom they can share whatever has come up to their mind, because they go through a lot of highs and lows, and there are going to be a lot of mood swings during this time, particularly when they are facing their periods in the initial days and they don't understand themselves. They become much conscious about their beautification, how they are looking physically, what kind of dress they should wear. So there is a lot of those kind of things also happening to them, and that is the reason if they get a friend instead of a mother, they are really going to look forward to you in terms of the information, and then they'll not search it out outside. This saves them from becoming the victim, sexual abuse and victim of becoming a violent abuse, just because they have got friends at home. So that is what the gap filling has to be done by the NGOs, that NGOs should come forward to have a parental sessions, how they should deal with their teenagers, what kind of mental setup teenagers have, and how that can be dealt with, in which way they should approach the teen girls, so that this kind of smooth communication sets up between them and things happen in a very, very good way for the girl child. Then only period positivity can be implanted into these girls. If you want to instill that they have a good healthy body and periods is very, very normal and happy to have, then parental education is must. So I think that is a very major role the NGOs can play in terms of delivering the information, disseminating the knowledge in the correct way. So that is it from my side for today. If there are any questions, I would take up the questions. I hope I could help few of the people here with what is puberty and the stages of puberty that girls go through, and we'll be coming through a lot of this kind of stuff in the coming episodes. Please keep joining us and keep sharing your views and suggestions to make things more improvised. Thank you so much.
Ma'am, on the chat box, there's only one question, which is like, would you be sharing your PPT? And that apart, we would
I can give the PPT.
Yeah, please share it with us. We'll ensure that. Yeah, we'll ensure that.
I'll send it to you, and maybe you can share it with them.
We could do that, and the session is open for questions. If you have a question, Poonam, is your speaker restored?
Yes, we are just managing.
Okay, wonderful.
Yes.
Any questions from your team? You and your team?
Okay. Do we have any questions here? You can ask. You can ask. Ma'am, can they ask in other language if possible?
Oh yeah.
Yeah, sure.
Yes, please go ahead. I can understand Hindi and Gujarati. So those two languages.
Yeah. Any other languages we will translate. Let's see.
Yeah.
কিছু মাথায় ঘুরছে
I'm waiting for the question, please. Bengali is also fine. Yeah,
They
Bengali.
don't have any
Bengali.
questions right now.
Okay.
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 No
Wonderful.
problem. No problem.
Anyone else? Preeti, you have a question? Preeti, David, do you have a question?
Yeah, so let me put up one question then.
Yes, sir.
Yeah, so it was great listening to you, Dr. Shah. So I'm calling from Assam. I'm heading an NGO called Sanjog. So our thematic area is different, but then we think this to be equally important. And we are into a rural setup. Periods are like a kind of the way it's being treated. 3 days isolation for the girl. Also, we take it very differently. We think it's a rest period. Girl should get some rest. But then again, there are lots of misconceptions, misgivings regarding this period. So, how do we take this to a rural setup? Because there are very few NGOs working on this menstrual hygiene. So we are also very new to this. So in a very, say, common man's language, how do we take this up? That's the question.
I think, sir, you can prepare a few small modules and you can have pictures, picture books developed. So when I started my journey, I was being taught to utilize certain particular pictures which can be used to be explained to the people. And you can start with small groups. If your village has a school, then try to communicate with the school and have the school under your confidence, and try to have some activity through the school, so that those girls who are coming to the school, at least they will be the ones who will be able to start getting the information that you really want to share. And do not do it directly by some lectures, because that doesn't reach them. You need to do it by some activity mode, because then those activity mode only will help them understand about the physiology, anatomy slowly. And don't directly jump onto the periods. You start talking to them about the physical body first, so that they need to understand the body parts, the simple biological meanings. Just teach them little about the body parts, the physiology, and in that you incorporate the periods a little. And once they start understanding the period science, then you can incorporate the misconception part also. But that all should come in the format of some activity. The activity can be some dramas, the activity can be some drawings of the charts, the activities, there can be many activities which you can design wherein they can link up with their body. And schools would be the good place where you can start. If your village has another, you can ask the students
Your voice is cracking.
now I'm audible.
Dr. Shah, maybe you can switch off the video. Yeah, there's a bandwidth issue, I guess. We can't hear you.
So what can be done is that you can take a there in the village and start having it on it. But when school is going to be a good start for you, and will help is going to be the better version to you and
I think
Dr. Shah, there's a little lack of clarity of the voice. Maybe you can switch off the video and that will possibly be
I have switched off the video. I have switched off the video. I'll just repeat that.
Static. Yeah, now it's better.
Yeah. So being a village, you can start with the village school. So village school, there must be girls coming to the village school. So you can ask the village school to allow you to do some basic activities activities, and through the activities you can make them aware about hygiene, about their body structures, about menstruation. And once they start developing confidence in you, then you start talking about period and period misconceptions, because you need to develop a bondage with them. Unless they have a confidence and trust in you, they are not going to listen to you. Now that can only happen when you go through some activity which they like it and which are simple to understand and which they want to do it. So I think village school will be a best place for you to start undertaking the activities.
Dr. Rituja, can I just ask something?
Yes, please.
Yeah, thank you so much. And this information was actually very nice. And since you were talking about the activities, I would like to ask, can you, because we are from Saksharam Foundation, we also are going to be doing this on a vast scale. We are going to be doing the awareness campaign, starting the awareness campaigns on especially the period talks, and we're going to be arranging all of this. And we have in fact initiated it also, and the session went very, very well.
Yeah,
Hello?
Pooja, so we will have one session arranged wherein we'll be trying to talk about different activities which can be incorporated and which can reach the science we made in a very easy and
Yes,
simple
yes,
way
yes.
to this village.
Because if we don't involve activities, this we
It's very
cannot
dry.
make it.
It's very
Yeah,
dry.
yeah,
It doesn't
yeah.
make sense. You
Yeah,
have to go through
absolutely.
activity only.
And personal experience, storytelling, all that we've already been doing. But what all activities can you do to just
Surely.
talk about hygiene? So there will be obviously a lot of things, but since you are already into this line, you would have that prepared, and I'm sure you're already doing so much. So it would be great if we will have more collaborations on this.
Surely.
Okay,
Yeah,
wonderful.
hi. This is Piali from Saksharam again, Saksharam Foundation. So both Pooja and me, Piali, we are running this Saksharam Foundation. And Rutuja ma'am, that was really very, very enlightening and informative information that you gave us all. And but this covered the biological part of aspect of the whole thing that we are looking at. So another question that I had in mind was regarding the sanitary pads that the children would be using, and we have a lot of work to be done on that area, because we are looking at how the pads can be environment friendly, whether they are using the menstruation cups or not. So would we be looking at more episodes where we will cover
Yes. I will be covering all of them slowly.
Okay.
This is just the first one, because then we don't want to give everything in one juncture. So
Absolutely.
we will be doing it slowly and steadily so that each part can be justified properly.
Okay, great. So that will be a learning.
So everything we will be covering. I will be taking the whole of this part till menopause.
Okay.
And that will
that's
include
what
menstrual
exactly.
disorders also.
Yeah, that was what exactly I had in mind, because when we go forward with this topic, then we should be ourselves be equipped properly with every
Surely.
aspect of the topic.
Now in the next part, I'm going to discuss about the anatomy, because usually that is also not known to people very clearly. So I'm trying to put things in a very simple way, which can be easily understood and which is the basic required for everybody.
Yeah. Thank you.
Thank you. So Ruby ma'am, are we done?
Unless we have any more questions, we can take on 2 more questions if there are. Hope classes, do you have a question?
No. I don't have any question.
Okay.
Actually, I just entered into the conversation. I got a little bit late. I will be occupied.
Fair enough. Unless anyone else has any more questions, we shall see you on the 28th of next month. Every 28th, we're going to have a session. And along with Dr. Shah, we will slowly put up other facets of this journey of a woman and whatever it takes to go through it smoothly and what can be the challenges and how can we deal with it. Thank you, Dr. Shah, and thank you all the participants. Had a wonderful time. Look forward to many more of these.
Okay, but thank you
very much. Bye-bye.
Thank you.
Thank you, ma'am. Thank you,
Have a
ma'am.
great day.